we all learned so much from COVID. And we learned that there were real pluses to partnering with private sector because COVID was a big shock to the system, and not all health systems actually survived that shock. I do think the Nigerian government did an amazing job making sure that they continue to protect the health and well-being, of Nigerians across the country, not just with regard to the pandemic, but ensuring that essential services continue to be provided and the essential medical needs of people continue to be met. But I wasn't on ground at the time, but what I've learned and what I've been told is that most likely could not have happened, or at least could not have happened the way it did without the involvement and engagement of private sector. We know already that over 50% of Nigerians are getting their medical care from private sector. And so when you have a kind of emergency like a pandemic, how do you quickly mobilize private sector, local private providers to actually be part of a response? And we were very proud that the work that we've already been doing with local private providers and working to make sure that they're integrated, as you said, into a mixed health system. And actually, I like to think about it as one health system, because for women who are seeking services, they're not saying, well, this is private, this is public, I'm going to make a decision based on the categorization. They're making decisions based on, do they think that they can get high quality care from this person? Is it convenient to them? Are they treated respectfully? And so those are sorts of the things that we have been working on, for a number of years now, to make sure that wherever women seek care, it is safe, it is of high quality, and it is respectful. And the work that we're doing is to, again, bring in these local private providers that are providing high quality, safe, and respectful care into government frameworks so that government can actually benefit from the augmented capacity that they can provide. They can help to decongest, public sector facilities. And we also know that for some services, people may not want to go to public sector facilities. So we do need to have options available for everybody. So this question of, how do you ultimately integrate private sector into government efforts is not an easy one. There's not a silver bullet, there's not one answer. If this was easy, it would have been done, already. And so I think the first thing is that it requires a shared vision and shared will. If you are not on the same page about what are the optimal, what's your optimal vision? What are the outcomes? And for us, it's simple. Again, no woman should have to die while giving birth. And I think the government of Nigeria shares that vision, shares that aspiration. So we can start, from that place of commonality. And then we can look at, well, what can we bring to the table? And what can other actors and stakeholders also bring to the table? And we recognize that we're bringing complementary things to the table. One of the things that we've learned, as I said, it's not necessarily easy. So we think about, integration from, again, I call it the 4 Ps. I like to use, all of these easy ways to remember, how we work. So the first P is people. The second is practices. The third is processes. And the fourth is policy. Nothing works in any system without people. People who are behind your vision and believe in your vision, and people who are doing the hard work every day to get those high quality services to women and children. And so we, as I mentioned, invest in people, in increasing their capacity to provide an expanded range of services, increasing their capacity to provide a higher quality care, and investing in that continued capacity for the future. Around practices, I keep on talking about quality because we want to make sure if people are using, their hard-earned naira to access care, we want to make sure that the care is actually saving them and not harming them. And I know there are just too many stories, in this country about where people have sought medical care and have actually been harmed and not helped from that care because it's not high quality. The third P, practices. We need to make sure, actually policies, processes, thank you for reminding me. So it's people, processes, policies. So we're on processes now. We need to make it easy. We need to make sure that it works. Data needs to be able to move between different points of services, whether it's public sector or private sector. We need to make sure supply chains, are also able to bring essential commodities and high quality commodities to public sector or to private sector. And we don't want duplicate processes or duplicate supply chains, because we want to make sure that we're actually leveraging resources for that end goal. And then last but not least, the policies. Without things like the new task shifting policies, which are allowing, for example, PPMVs to provide high quality, expanded range of family planning services to people in their communities, I do think we would have missed an opportunity again to augment government capacity. I believe also, the new strategic framework for community health workers, is again also another policy mechanism to make sure that local private providers are fully embraced and integrated into the system. We were just speaking with one of our partners earlier today, Society for Family Health, and they've told us that they have been able to train over 2,000 PPMVs that have served almost 500,000 women and children, and provided, again, not just essential family planning products and services, but they've also been able to help identify children who are suffering from malnutrition, who may have a diarrheal disease, who may have a respiratory lung disease, and all of these things that we know, and malaria as well, and all of these things we know can be life-threatening for our children.